Thanks for staying with us. So still talking about children, but this time cancer in children. Will be interviewing our guest from Doctors Foundation, Doctor Cancer Foundation, Olufunmilayo Fagbemide. She's a medical expert from the Doctors Foundation. Welcome to the show, madam.
Thank you for having me.
So we know Doctors Foundation is a friend of the house because Nima is very, she's somebody who's very passionate about cancer in children, and she's worked very closely with your foundation. Tell us a bit more about the Doctors Foundation and what your experiences are on a daily basis and what are your needs at this time.
Okay, so Doctors Cancer Foundation was founded 7 years ago because we noticed in recent times or over time, people know about breast cancer in women, they know about prostate cancer in men, but people don't really put children and cancer in the same sentence because every time you come, oh, this child have cancer, they say, God forbid, it's not my child and all of that. So we don't get people to know about cancer. So what Doctors Cancer Foundation is doing, like, we need to create awareness. People need to know that, yes, children really do come down with cancer, and there are things you can do when this happens. There are things you can look out for when you, whenever you're raising your children. Not like every step of the way, you keep checking your child every day, but like when you see red flags, there are things you need to do. So that's what the Cancer Foundation is trying to do. And we're doing that by trying to raise funds. We create awareness periodically. Like, I say a lot, like, September is not enough to talk about childhood cancer. We need to talk about it every month, every month. In fact, even if it's every day, it's still not going to be enough. People need to know that children do come down with cancer. And what we're trying to do, we create awareness, we do research, because it's a different thing for you to fund the cancer, and it's a different thing for you to, like, let's find out what exactly is causing this cancer. What can people do? How can we intervene? What can we do to push this cause forward? So that's part of what the Cancer Foundation is also doing. And then we train healthcare workers, because it's not a one-man thing. It's not something just an oncologist can sit and say, okay, yes, I can be everywhere at the same time. We need to train people to know what to do, who to refer to. When you see this, what should you do? Who can I send this child to? Okay. And people need to be aware to be able to do that. Okay. If a nurse in a primary health care center doesn't know what to see or what to look out for, they'll just refer the child home and just write anti-malaria or typhoid medication or something and just send the child home. But when you've trained them to, okay, this is what I should look out for. When I see this, let me refer this child to a pediatrician. Right. Let me do this. You understand what I'm saying? Right. So that's what we're trying to do.
I love the fact that you mentioned partnering with, healthcare workers and some basic, or primary healthcare services like nurses. Yes. How has that been? What changes have you seen? How productive has that been?
Okay, so I would say, like, in fact, it's been positive all the way, at least to an extent. It's not giant stride, like, we are not there yet, but little change matters. Like, we are seeing positive change, Now, for the healthcares that we've been to, we shared questionnaire before, before we start, and for each time we go there, before any intervention, before we start training them, we hand them questionnaires. Let's even know what knowledge you have of this childhood cancer. Like, do you even know anything about it at all? Yeah. And then when we just shared the post-interventional questionnaire, okay, yes, these people now I know about this. Yes, they are aware and they are doing the right thing. They know what to do, and it's been positive. At least to an extent, the prevalence rate has increased because people are now referring these kids to the hospital. They know what to do. It's not like when they see this, they'll just, write you medication and send you home. Right. They're actually doing well now. Okay.
Yeah, so I'm glad you mentioned that the foundation does a lot of research. So I would like to ask you, what are the statistics of Nigerian children who are down with this cancer, and what are some of the signs or symptoms that would tell you that this child is likely to have cancer?
Okay, so unfortunately, we are not 100% there. Like, we are still on that route. We are on the way. So we don't have a true data, like a figure, like to total how many cancers we see in a year. But in Luz, the oncologists in Luz, they can say, like, they see about 20 new cases every month. And globally, there are 400,000 cases globally every year. So, so these people are coming, right? And we are trying to, let them know, like, when you see a child, it's not a one shoe fits all kind of thing. It depends on what body part has been affected by the cancer. But generally, like, for instance, let's say leukemia, when you see your child, like, this child, and children don't pretend. When they are ill, this child is sick. Do you understand? They can't pretend like, oh, mommy, I'm pretending not to be fine when I'm fine. Or like adults. Do you understand what I'm saying? No offense. But like, when a child is running fever, this child will not normally play after school. The child is not playing. Or the teacher is calling from school like, oh, this child is just unusually quiet and all of that. I'm not saying it's cancer, but like, that's a red flag. As a parent, like, my child is usually not like this. I know every Nigerian family has a nurse on speed dial. Like, call mama this thing to come and, you know, administer
Oh,
this
yeah,
and
nurses
that.
on speed dial.
You
have a
understand what I'm
basket.
saying? Yes, exactly. And you have a basket and all of that. But, like, when you treat the same thing over and over again, like first day malaria, second day malaria, that's a red flag. Take this child to the hospital to see the doctor.
Share a few, because you see, when people hear foundation, they just think it's so far-fetched. Oh, that's what they're doing, well done, cool share. But the truth is that you need support. And I need you to share a few of the stories you've experienced. Maybe a young boy had this type of cancer, the funds that the doctors put together, how they would do surgery. Do they care for the person in Nigeria? Do they fly them out of the country? What's the procedure? So whoever wants to support you can say, oh, okay, this is what I can, this is where the money's going to go. So what are the things, some stories you have that you can share?
Okay, so usually we get to see lots of children. It's saddening, but we get to see lots of them in clinic, you know, they're here, and most time when they present is late. But regardless, we still try as much as possible. And good news is we have some of these modern equipment now in Nigeria, modern medical equipment now in Nigeria. So, because before we had to fly some of them to Kenya to, you know, do something we call a PET CT scan for imaging. But right now we have it in Nigeria, like it's accessible and it's cheaper because you don't have to pay the airfare and all of that. So when they come, you see these patients, you know, you create a treatment path for them. Like, okay, it depends on what stage you're presenting. Some of them will need surgery, chemotherapy, and radiotherapy. It depends on what kind of cancer and the stage. So when we outline the treatment path, it's a lot of financial burden. Immediately you're telling them this is surgery, this and that. You see the parents are already downcast and all of that. So what we try to do in Doctors Cancer Foundation is, yes, okay, we agree, like you don't have enough money, but like how much do you have? Do you understand what I'm saying? Do you have any help anywhere? Can you raise this fund elsewhere? No. Okay. How much do we have? We sit together with the parents, discuss, okay, this is how much the Cancer Foundation can help you. We're not going to give you the money, but we are partnering with pharmaceutical companies and other private parastatals too. Like, okay, if we need to do surgery, we can send you to this hospital, we'll foot the bill, you know, you will get your care, everything. So that's what we do. And to an extent, I can say I'm really proud that we have some of the survivors, and some of them even in university right now. They are doing very well, and we invite them back to come and talk to the young children that have just been recently diagnosed. So they know, like, it's not just you. There are other people that have been there. And, like, so we fund them directly. When they come to clinic, we just profile them, fund them. But we don't give them the money straight up, of course. And then, like, pharmaceutical companies are on board. Laboratory services too, they're on board. Imaging, like, so many people. But we need more because it's never enough.
I've heard that the recovery rates in children with cancer is very high. Yeah. Is this true?
Well, it depends on the stage, but 90% when they present early, yes, it's curable. 90% when they present early. So that's another reason why we are shouting and saying this over and over again. Don't wait at home, because cancer is very, I don't want to use the word, but it's drastic. It can move from a stage 1, like from the primary site in which it's starting from, and move to a stage 4. When it's at stage 1, it's still confined. I can do something about it. It can be cured 90% of the time. But when they tell you stage 1, this child is stage 1, and then like, okay, ma, we can do this. This is like what we're going to do. And then you just, you know, pick the child up, straight to a religious house, start doing all sorts. And then by the time you come back, it's already a stage 4. By that time, there's really little to nothing we can do.
Sad. All right, so what are the most popular cancers you've seen in children that is most common?
Number 1, leukemias. Okay, so yes. So
that's cancer of the blood.
Yes. An overview. Normal, every organ in the body has their cells that, you know, they grow, they divide, and they die. But what happens in cancer is that these cells, while dividing, some of them divide into abnormal cells. And rather than die, they continue to grow and divide. They don't die. They remain there. They remain in that organ that they've originated from. So when they remain in that organ they've originated from, the normal cells are supposed to function. For instance, in leukemia, white blood cell counts are like soldiers. They're supposed to protect your body against infection and all whatnot. But these abnormal cells are there. They become lord over that organ. They're not going anywhere, and they won't even allow you that should function. And then when they are done, like, suppressing the function of that organ, like the white cells, it affects the platelets. So you see the child coming down with fever. The child is bleeding. Like, children play a lot, but like after a couple of minutes, they bleed, and maybe apply pressure for like 1-2 minutes, it stops to bleed. But in them, they bleed for like a longer time, and then any small thing, they just start to bleed. They feel dizzy. They're always tired, and all of that. So, and then when it's done with that, you know, the original site, it moves to another place. Starts the same cycle over and over again, take over, stop those ones from doing their normal function, and then, do you understand? So that's how it works. Aside the leukemias, we also have the retinoblastoma. That's the one for the eye. So that one, usually, it starts like a small, tiny white dot in the eye. When you put off the light, the child's eye starts to, you know, is shining like that of a cat.
Yeah.
Yeah, so that you see that as one of the symptoms. Then you can also see that the child's eyes become red, it's swollen, and then there's this deviated gaze. Like rather than look straight, it looks like the child is not looking. He's looking at you, but he's not looking at you.
Strabismus form.
Yeah.
You know, we have something called Kotapas form.
Yeah, some of them are born with it, but and a normal child just all of a sudden starts having this strabismic gaze. You're like wondering, something is not right. My child the child wasn't like this yesterday or 2 days ago. As a parent, that's like a red flag. You need to. And then there's another one, nephroblastoma. That one is some parents, maybe while bathing their child, they notice like there's this hard mass in the child's stomach. Red flag, go to the hospital. They find like, okay, yes. So is that what I'm saying? Like, it's not maybe when you see a mass, when you see this, because some of them don't even present with a mass. In leukemia, like fever and all of that. So it depends. Like, once you see a red flag, like something is not right with my child, please.
So the advice is, once you notice anything abnormal in your child, take them to see a pediatrician.
Once you notice anything abnormal, like you treat it once, it's not going away. Second time again, they're still telling you it's malaria. Third time, they're telling you malaria. That's a red flag. Like, no, this can't be malaria anymore. This can't be typhoid anymore. Like,
what about those who cannot afford to go to a proper pediatrician?
Okay, so that's what we're saying. Like, when we train the healthcare workers on the community health level, it's not everybody that comes down with fever that is cancer. Do you understand what I'm saying? But, like, when you train the healthcare workers, they treat something once, twice. They know what to do. Refer the child to a general hospital. There are pediatricians there that can see the child. So for people that are like in the low economic strata, they can like go to general hospital to see pediatrician. But you can't say because malaria or anything, you're just going straight there. That's why these people are trained. It's like a chain.
So that they can identify.
Yes, identify when there's a red flag and then send you to the appropriate place. So awareness and prompt referral. Don't waste any more time because the longer you wait, this thing, cancer doesn't yet sit down there and it's going to see it. Do you understand?
Let's talk about parents because one of the meetings we had at the foundation, I visited one woman. She looked very well to do, but she was really confused. Her child had the stomach cancer. He was swollen. And I saw that she was very, I saw that Mama Dorcas and they were talking to them. How impactful are such support and, counseling of parents?
It's a lot. It's because cancer is not like malaria. You go into the get treatment and you walk out. Cancer is a journey. I always say it is a journey. No matter the stage, even in the early stage, it's a journey. So it's not something somebody can attack headlong. You need emotional support, psychological support, like 100%. And it's helping because when you have like somebody you can talk to, when you've been prepped, like, okay, this is what you should expect. This is what you will see along the journey. You are prepped. So when you see it, it's not just somebody dumping something on you. You are mentally aware, like, okay, yes, they told me this is going to happen. Okay, yeah, I'm prepared for it. I need to attack it. I need to be strong. I need to do this. You talk to yourself too. But if you're like naive, you don't know anything, when you see it, you're scared. You don't know what to do.
Well, how do you help? I mean, have you taken your sensitization to religious houses? And the reason is because many people would describe cancer as an affliction.
Attack.
An attack that somebody came from the pit of hell, it's from somebody's family, and then they want to start deliverance services, which is normal for us in Christendom. Yes. But do you also find a way to talk to churches where when something presents, instead of how they can also counsel their members to ensure they get proper treatment, especially when it comes to children? You as an adult can choose to stay in church, but a child should be taken to for proper care.
Well, right now we are trying. But there are so many religious houses in Nigeria. You can't go like
everywhere.
Yes, you can't knock on everyone's door, which is why we're trying to like maybe doing conventions and all of that if we can chip it in. But like they are getting on board too. So I'm really happy that people are getting sensitized now. Like children do come down with cancer, and these religious leaders too are aware. Do you understand what I'm saying? Like, but we need to do more. We need to do more. We don't mind partnering with them. It's not an affliction. It's not spiritual. Like, if you do the right thing, this thing can be cured, this thing can go. Yeah. But we just need people's positive, open-minded. They need to be open-minded to be able to see that.
Do you think that over the years, the cancer in children has increased? Because a lot of people are saying, oh, our phones, our electronics, putting them on your legs, your laptop is giving cancer. People give their kids these devices. Yeah. So do you think it has increased because of these or it's just the same?
I would say not. The reason why it has increased now is because we have diagnostic tools. To detect it. Because before now, when you come in and then you tell you have to fly you here, you have to do this test, you have to do that, everybody, they run. So that way you can't even detect what the problem is. But now that we have this thing in our backyard, do you understand? If a child comes down with this, I can send it to this diagnostic center to run these certain scans and all of that. I know what is wrong with this child. So that's +1. Unlike before, like when you tell them this, they just run off. And so it's not, number one, it's not all of these gadgets causing that. But like study is still ongoing to find out the exact cause. But it's not what a pregnant woman ate during pregnancy. It's not you not giving your child supplements. It's not you not doing certain things. Yes. Because some parents come in, they're like, oh, is it my fault? Is it something I did wrong? Is it something that, no, it's nobody's fault. Like I said, this thing happens. When the cells are supposed to divide, they just, choose not to divide the way they should divide, and it happens.
There are some people that believe that if you get cancer, if a person gets cancer, they should, if you eat right, the cancer cells won't grow. There are some vegetables or herbs that you can take.
Cancer feeds on carbs and fat and all that.
Okay, so I'm really thankful that you asked that question. Cancer cells are erratic. They don't care what you eat and what you don't eat. If you drink water, cancer cells will still take the nutrients from wherever and feed on it. So regardless of what you eat, regardless of whatever, they still have to feed because they don't care about the normal cells. Normal cells are programmed. They know I can't go here. This is where I should be. But cancer cells are like all over the place. So drink water, take vegetables, take carbs, whatever it is you take, they'll still take what they need to grow because they don't care about you.
You just started an interesting conversation because I need to bring you back for this. Because there's a multi-million-dollar industry that would sell all sorts of, take soursop, take these vitamins, take that, it kills the cancers. And you're saying that, really, it's probably not true.
Even aside that, these people spend so much money on these supplements.
Yeah.
And then cancer is just down there, proliferating and spreading and all of that. And in your mind, you're taking this supplement once a day, twice a day, you spend hundreds of thousands of naira.
It's very expensive.
And then you get to the hospital like, this is what you should do. There's no shortcut to it. This is what you should do. And then they go, oh, you don't have money or you spend so much money on this and that.
Thank you so much for coming.
Thank you for having me.
Thank you very much for. I mean, it's important because Nima doesn't joke with this foundation. She's very passionate about it, and we try to support the best we can. And I'm happy that you guys are obviously seeing results, and 90% of the cases that present are able to be cured. And I'm also happy that you're doing some work with the religious bodies to ensure that you sensitize our members to make sure every child who may have cancer is properly taken to medical center to be well checked. Yes. And we also, the good news that we have the equipment to diagnose. So for those of you thinking that every small thing, let's fly, let's fly, you can actually get a proper diagnosis here. If you now choose afterwards to leave us, but at least you can get proper diagnosis here in Nigeria. That is all we can take on the show today. Hope you learned a few things as we have. Have a great day. We'll see you tomorrow. Bye for now.